Hello, everybody, and thank you for tuning in to the Liberty Report. With me today is Daniel McAdams, our co-host. Daniel, good to see you today.
How are you this morning, Dr. Paul?
Good. Beginning of the week and ready and raring to go.
That's right.
Solve another problem.
Couple problems.
Of course, I've been saying that for a long time. I guess it's hard to measure, and I think that is the truth. When we're in this type of business, or no matter what kind of freedom group it is, you never know what the results are. And I keep thinking about all the young people that call me that have their own little organization. Yeah. And somebody said, why do you go on there? They only have 2,000 people. Well, 2,000? I used to go for 20. Yeah. So there's a lot of people out there and a lot of changes, so that's where I get my optimism. So that's why we keep plugging along, do our best to get the information and sort it out, because we occasionally find some good news, people move in our direction. I think we have a little bit of that today, at least information. We have the CDC report, which is falling our way and trying to explain that the data is not reliable, and also that there are some results in Berlin and in Europe where it's showing that the people are rebellion. Actually better than the Americans are.
Much better.
I think they're rolling over. Adam Dick, our staffer, has written an article, really goes over this details about what's going on in our colleges, how they're destroying people. And, we still nervously have some in our family still in the regular teaching business, and kids in the regular schools. And it is just devastating to try to raise kids doing this. And it seems like it's deliberately to really get you upset, especially if you have kids at different ages and different schools. And then they break it up. Some is home, some is doing this, and some of you attend classes. And it's a good way to make people nervous. And the kids, too. It's not only the parents who have to hustle and run. It has to be the kids, too, get all upset about this, because they believe it or not, kids like to be organized. And they like it when people give them a little bit of help structuring what they're going to do. But we want to go over the CDC report. And this is really something that we suspected, we talk about, we knew it existed, but this is some, firm evidence. What's going on, how they count. The data we know has always been fudged, and they've come up with a new number saying that 94% of the COVID-19 deaths in the U.S. had other factors. Yeah, Maybe COVID had nothing to do with it, but it looks like out of this group of reviewing, only 6 did they say they were claiming that, we would put them in the category that those individuals died from the virus, not with the virus. And this is the whole thing. If we ever got to the point of saying, instead of COVID-19, hysterically pandemic and all this stuff, if they ever said, this year's cold virus, something like that. Oh, it's a lot worse. Yeah, it might be worse than average cold virus, but it's not. Some people argue it's not worse than influenza. There's some stats on that. But when the dust settles, we're going to have a more accurate, as some honest researchers go out and research this, going to find out that it wasn't anything like they portrayed it to be. But you say, well, that's good news. Well, it's good news that they're finding it. It's a little late. The sooner, the better. But the whole thing is, if they find it, it might be too late, because the process is going to be in place. They're sort of waiting. If this falls through, I think that it's when I read the CDC report, I thought, well, could this be cover? They're coming out and saying, we did this and we weren't hiding anything, and now they're leaking out the truth. But that's too conspiratorial, so that wouldn't be true. So
it is, and it's a bombshell, and we can actually even put up the first clip. This is from the CDC's own website. This is a report that came out over the weekend. This is in the comorbidities section of the report. For 6% of the deaths, COVID-19 was the only cause mentioned. On average, there were 2.6 additional conditions or causes per death. And additionally, most of those who died of that 94% were of an extreme advanced age. So this is, in a sense, it's a bombshell, because, and a lot of people are saying, well, that means only about 9,200 people died from COVID alone. And that is not entirely accurate. And in fact, Alex Berenson, who's I think done the best work on this, he's a former New York Times reporter, right. And he's been on TV all the time about it. But he makes a point that it's not accurate to say that only 9,000, because some of those comorbidities really are conditions that can be related to a COVID death, like pneumonia. But it's probably fair to count that in a few others. So what Berenson did is he went through it and he said, let's take out the comorbidities that clearly weren't related to COVID death, even though COVID was on the death certificate. And he pointed out Alzheimer's, sepsis, dementia, cancer, and unintentional injury. Remember we talked about that motorcycle accident, that was COVID. Suicides, there is a section where suicides are listed as COVID. So he says if you take out those that are clearly not related to COVID, even leave in things like diabetes and obesity because that can be related, even if you're so conservative you do it that way, by his estimate, there are about 50,000 certificates, COVID certificates, he said, assuming no double counting, which certainly could be the case. But that is a far cry, even if you leave those things in, 50,000 deaths rather than 160-some thousand deaths. That is a regular flu season. I think in 18 we had 80,000 deaths. So it's clearly, even if you approach it very conservatively, and you don't want to say only 9,000, there's clearly something that's changed since these numbers have come out.
The one statistic that I don't think we're going to see, and someday somebody might try to sort it out, but it'll be very controversial, is the iatrogenic cause of it. Because doctors do make mistakes, and sometimes they're for political reasons, all sorts of things. But they make mistakes. Everybody that got put on a respirator was done with the intent of doing what they thought was the right thing. It turns out, I don't think any doctors now say, get them on a respirator real fast. This will head off the seriousness of the disease, that sort of thing. And but I don't know. I don't see them soon sorting it out and say it was the treatment. What about the denied treatment of hydroxychloroquine? You know, that's still up in the air, although I have a strong opinion about that, and I think that the FTC was completely wrong for essentially taking it off the market. So they may have contributed to some of the problems too, and even the ones who died, you'd have to go and look and see if either of those things could have been contributing. Did the doctors actually contribute to it? We know the politicians have, but did the doctors do it in error, not realizing that the medical treatment, the current medical treatment was, part of the problem? I think they're coming around now, especially some of the doctor we read. They have a pretty good, protocol on the right antibiotic and what to do and avoid the respirators and use hydroxy.
Well, you remember when they passed that big bailout bill, there were incentives in there for hospitals to list COVID. There were financial incentives to put people on ventilators. They collected, I think, $30,000 for each person they put on a ventilator. So it's not to say they purposely tried to kill these people, but the net result was they killed a lot of people and they got a lot of money doing it. But I think there are 3 lessons from this report that we can take away. 3 very solid lessons. First of all, COVID-19, coronavirus, is far less deadly to healthy people than the governments, the media, anyone has ever said. Clearly true. Second of all, we should have protected the vulnerable more instead of actually doing things that made them more vulnerable and more susceptible to death, like putting sick people in the old folks' homes with them. The third, lockdowns not only did they not save lives, they actually killed more people than the coronavirus, all out, if you look at these numbers. I think those are 3 really important things. And I wonder now, and I've seen some things, and people are talking about litigating the destruction to society, destruction to people's lives from the lockdowns. Maybe if we get to that point, that'll be the next phase. But you wonder, you don't want to be too conspiratorial, but you wonder, what was the incentive? What do people never let a crisis go to waste? Let's look at this next clip. And I just threw this in here because it's pretty fascinating. I don't know what there is to it. This is the founder of the World Economic Forum. This is good buddies with Soros and Bill Gates, Klaus Schwab. He said, the pandemic represents a rare but narrow window of opportunity to reflect, reimagine, and reset our world. Okay, no thanks, Klaus, right?
Right. You know, it does seem strange. It's hard to believe it's all a coincidence. And at the same time, the Marxist movement just got really energized. It was you know, in line with and occurring with the coronavirus. So this is something that people notice this, and that the economic controls all of a sudden much further along than anybody ever dreamed, that they would be able to close down governments, close down schools. It just is so overpowering, which means that they knew what they were doing exactly, because they knew what we know, in that it's a philosophic fight, and you have to convince people of certain beliefs. Our universities have been polluted for a long time. The school teachers have all gotten their lessons from the universities, and all of a sudden, everybody's involved. You know, I would notice that, and you did too. You know, in Washington, when we would try to explain non-intervention foreign policy or an economic policy, well, they all learned their stuff from the same place. There's only one university out there, except for a few exceptions for that. But they all learned the economics. I can remember, I got a little charge out of it. In the campaign, I've had some pretty well-known interviewers ask me in a friendly way. I think they were a little bit curious, and they weren't being nasty. They said, well, what is this Austrian economics? You know, what is this free market stuff for business about? And yet, it's a significant philosophy. But they knew this. They've infiltrated, and it is bursting out. But guess what? In a little bit, we're going to be talking about maybe our side is bursting out and expressing themselves when you look at what's happening in Europe.
Yeah, it is, and it was an exciting weekend in Europe, literally all over Europe. But exceptionally in Berlin, they say it was the largest protest in German history. And this is Germany, so that's saying a lot. Let's look at this first. They say the estimated millions of people showed out in Berlin to protest against lockdowns, against face masks, against being shoved around and pushed around, forced to have a needle stuck in your arm. And it was absolutely incredible. Let's look at the next picture. There are so many fascinating pictures of this. To me, they kind of look like ordinary people, Dr. Paul. And let's even look at this next one. There's a slogan that I think you're going to agree with in the next picture. Read Mises, not Marx.
There you go.
And in fact, our new friend, RFK Jr. was there, and he gave a blockbuster of a speech. Let's listen to a few seconds of this, because this is the part, and there will be a quote afterward. This is the part that's so fascinating that he said, if we can, when we get that queued up.
Governments love pandemics. Regierungen lieben Pandemien. They love pandemics for the same reason they love war. Und die lieben sie aus den gleichen Gründen, wie sie den Krieg lieben. Because it gives them the ability to impose controls on the population that the population would otherwise never accept.
Yeah, let's put up that quote with Dr. Paul reflects on this.
Yes. You know, you mentioned Robert Kennedy, our new friend, and he's closer to us than I ever dreamed. But you stereotype people. But I think what his relationship with us now is evidence that coalitions are good, not compromising. I always think there's a big difference between moderates compromising, giving up. Each side gives up some of their beliefs. But a coalition, now when we've spent time, you know, with Robert and what he's doing, you know, there's not much he says about vaccines and all that we wouldn't agree with. And boy, on the CIA and the foreign policy, I thought his one quote about you know, you can't, if you have a foreign empire, you can't have a republic. And so he's very close to that. And I think that is very good, because the coalition is the way to go, and you shouldn't write them off because you will never get everybody to be a libertarian, but their side's not all going to get all of them to be Marxists either. And I think the other thing, working in coalitions, and I think about working with my friend Dennis, that when you're friends and you agree, the other things become less vitriolic.
Yeah,
you know,
yeah.
you say, well, maybe there's a way we can work it out and soften stands. And so that's why I think what Robert Kennedy's doing here is just fantastic. And the crowds are unbelievable.
Unbelievable.
You know, and the other thing, there's a little bit of symbolism. I think it's great symbolism that it's Germany. It's huge. Hitler used to get big crowds out there, and you never used to see Misa signs out hanging out now. So we saw a few of those during our campaign in different places we went. So I'm absolutely convinced that if you don't have people thinking about ideology and recognizing when your enemies are, you know, determined with ideology. That's why some of these people say, how could they do this? You know, it doesn't make any sense. They're attacking their friends. But if you want chaos as part of your philosophy, you still get your chaos, and on you go for tyranny.
Yeah, for sure. And you know, RFK started his speech by saying, you know, the media in the U.S. is so corrupt. The mainstream media is so corrupt. They reported that I was going to Berlin to speak to 5,000 Nazis. He said, I'm looking around, you people are the opposite of Nazis. You're demonstrating for democracy and for your freedom and your personal freedoms. But come back to the U.S., turn on the Washington Post. How did they report it? Let's look at this next clip. Here's the Washington Post. German president condemns far-right protest in Berlin. 2 million Nazis, right? And here, let's take a look at these Nazis in Berlin. This is the next picture. Here they are. They're standing next to a big poster of Gandhi. Yeah, he's a well-known Nazi extremist, all right? But it wasn't only in Berlin. There was a massive crowd in London. Let's just go through have a little slideshow here. There was a massive crowd in London that came out in Trafalgar Square. Project Fear. Look at how many people here. Let's look at the next clip. Masks are muzzles. The new normal is new fascism. Freedom over fear. We will not be silenced with your muzzles. Nobody's got a face mask on, Dr. Paul, and they're not keeping 6 feet apart. Let's do one more. Yeah,
they're taking risks.
They're taking risks. Let's do one more on that one. Big Brother is masking you. Now that's a good sign. But this is just amazing. It's tremendous. And here's how the corrupt newspaper, The Guardian, reports it. Let's look at this. Coronavirus skeptics, conspiracy theorists, and anti-vaxxers. That's the only way they can report this, is to condemn them. But Dr. Paul, I'm going to, Here's some good news, though. I'm going to just give 2 clips to cheer you up a little bit after seeing that. Let's look at these next 2. I think something's happening in the European media especially. You know, this is the BBC. Coronavirus. Is it time to move on and get back to normal life? Great. And look at the next one, The Telegraph, and I'll turn it back to you. The West's response to COVID shows we have succumbed to a medieval mass neurosis. This is The Telegraph. These are mainstream papers in Europe, in the UK, that are starting to shake loose and starting to come in our direction.
Now, there's a certain individual that works in the Democratic Party, and she's been around for a long time, and she used to talk a lot, it's for the children. And I think her name was Hillary. It's always for the children.
Always.
That's why you have to do that. And I keep thinking, that Robert Kennedy uses children's health defense, you know, and he puts that, and I thought, now that's really something for the children. And then I see what they're doing now. I wonder if these Marxists could say, when they look with any common sense and looking at what the kids are putting up with when they don't get sick, and making them obey, you know, and submit and wear these masks. So this is, it's not for the children, it's for tyranny is what they're making things happen. And if you argue the case for liberty, I'll tell you, doing about the best you can do for the kids. Let them grow up in a free society. And many Americans have in the past, relatively free, at least a lot better than what's going on right now with the children in this country, putting up with all the regulations and the tyrants that we have. But these points that you've picked up and we've tried to make, I really do think that it's shifting. Maybe they'll just throw up their hands, and maybe you know, with modern day transmission of information, maybe it's much better than we realize. And sometimes, and it happens in in campaigns that so when somebody comes forth and nobody's supporting them, one person stands up and says, this is this, and all of a sudden, a lot of other people agree. So I think that is what's happening. The biggest frustration for me, and we point out, is when you get involved in politics, is to grasp if somebody might be saying something very correct, and we say, hey, this is good, they want to do this, but then it doesn't become, from a convincing format. They don't go through, they don't follow through. And people get hopeful and they get turned off. But I think that's the way politics will always be. But I tell you what, you can get more honesty when people decide it's an intellectual fight and we're going to fight this on a moral basis, and we don't have to think that we have to be bought and yet the money bias. We don't need the Bill Gateses of the world and his funny philosophies to change the world for the better, because it isn't being changed for the better if we listen to him.
Yeah, they're not going to stop with this. The mask, I think the masks are symbolic, and you've said it many times. You even had a great interview with Lou Rockwell over the weekend. The masks are symbolic, and that's only the first step before they start jabbing things in your arm. But it's not just the UK. It's not just Germany. Let's look at one other one. This is in Spain. They are furious. We can't live like zombies. Protesters in Spain decry COVID-19 mask mandate. That sign says political virus. So thousands of people showing up in Spain, even demonstrating against this virus. So it's going everywhere. Unfortunately, you look around the U.S., not much happening. You look around Texas, not much happening. We still, believe it or not, still have a mask mandate from our governor. What the independent state of Texas is not doing too much. I'll close out here if we're ready.
Right.
I do want to say that we're going to thank our super chatters after this, which we do every Monday. We appreciate your support to help keep us going, kick in a little bit of money to help keep the show. So thank you very much. I want to close with an update because we've been following Collin County, Texas a lot, and it's important because they're calling out the state, they're calling out the corruption in how they report these coronavirus cases. Let's just look at the next one. Judge Chris Hill, I think, is an outstanding individual, extremely brave. He's the one that put up on the Collin County dashboard, we have no faith or confidence in the state's numbers. And this is what he called out. The Texas State Health Service Department reported there were 4,736 active cases in Collin County on the 18th. Then all of a sudden, they reported a couple of days later, there are only 83. So they have revised. Let's look at the next two. You can even see it. This is on the dashboard. Active cases, 81 on 8/26. And just do the next one. Active cases before that, just a couple of days before, if we hit that last 4,640. The numbers are crazy. The judge has called him out on it, and they're having to respond. And there's going to be so much more of this, Dr. Paul, that comes out of this cooking of the books, these cowards who are not willing to stand up. It's disgusting, but hats off to the judge out in Collin County.
Very good. I'm going to close with a bit of a warning, not an overwhelming warning where we have to get nervous about it, but we have to think about it, and it involves the coronavirus situation. Because this week it was reported the first confirmed case of a reinfection. Well, you know, I would study that and see if people can prove to me, but we sort of learned, when I was in medical school, they still believed that you didn't get reinfected. You know, if you had the immunity for a disease, it was, you know, for life. Sometimes there were other types of complications. But anyway, it's out there. The first case, what I'm pointing out, and I think you understand, is the headline. Mm-hmm. Always keep you on your toes. But the other thing is that they're not giving up on is it will never be the same. That's hope. That's hope in a way. It's different. Is these people that are expressing themselves in Europe and in London and Berlin? It'll never be the same because they're not going to put up with this. But there will be, I think they've lost the fight. I think the CDC has to admit that they've overstepped their bounds and they're going to lose all credibility. But there could be a new virus coming. So that's what people have to be aware of. But I think people who have come around to understanding the concerns that we have will not be bamboozled, especially if we ever get this thing to go in a different direction. And I think the telltale sign will be the schools. The schools are, boy, that is a hotbed for bad ideas, I'll tell you. So anyway, the people will have to be careful about it, because the news will come out. And I think about the emergency powers that were gained after 9/11. They haven't been removed, and then when they started financial surveillance to protect the customers, from the government and snooping and all this sort of thing, and it was nothing more than more government control. And that's what this is. When you think about the plans that Bill Gates of the world have, they want more control of the people. And of course, if you're interested in liberty, you don't want that to happen. You want people to make decisions. You want people to understand what property rights mean. You want to have people understand what contracts are for. You have to understand why government should be very limited and their role precisely stated. And for me, if you're going to have a government, the government should be there to protect individual liberty so people voluntarily can take care of themselves. When the problems occur, it can be done in many different ways: voluntarily, local government, private organizations, all kinds of things. But you don't need the horrifically huge welfare warfare state. We don't need to be in every country in the world. No, we're only in 150 some where we have troops, and in order to be safe and secure. As a matter of fact, it undermines it. And yes, I'd like to be safe and secure. That means that we have to understand why government should be very, very limited. And that's why we have to get people to understand, be very leery of the power and authority of the Justice Department, the FBI, and especially the CIA. Because if we want our liberties, we have to assume responsibilities. And if it doesn't work out perfectly for us, because nothing is, you cannot say that, well, under these conditions, I had a bad deal and I went broke, so I'm going to go to the government so he can rob my neighbor to help bail me out. No, it doesn't work that way. It doesn't mean that it's cold and callous, because I think if you want to talk about humanitarianism, that is found in the cause of liberty, because there's more wealth and more volunteerism, less violence, less wars. So the opportunity to take care of those problems is just overwhelmingly larger than it is when the bureaucrats get control. And they give us Black Lives Matter. They can do anything they want done, burn the cities, and we have coronavirus lockdown, and at the same time sort of ignore one huge problem, and that is the ability of the Federal Reserve to finance all this, and people not pay much attention. But I do believe we're making progress. It's slow, but we need the help. So we are delighted when we have our viewers tune in and spreading this message, because that is what it's going to take. We need to spread the message. And I believe today we still, at one time they had to do pamphleteering. In a way, it's pamphleteering here, and it's small because we don't have control of the social media nor the regular media. But there's ways, the word of mouth and the power of ideas and the power of truth is on our side. And that's the reason I do hang on to the whole idea of being optimistic that we can change things for the better. I want to thank everybody for tuning in today to the Liberty Report. Please come back soon.